Good evening. My name is Dr. David Doman, and welcome to another edition of Housecall. What are the cancer trends in the state of Maryland? Find out right now. My guest this evening is Dr. Lin Tai, Acting Director for the Center for Cancer Prevention and Control in the state of Maryland. Dr. Lin, welcome to Housecall.
Well, thank you for having me, Dr. Doman.
Our pleasure. So briefly, tell us about the agency that's with the Department of Health in the state of Maryland.
Sure. So I'm from the Center for Cancer Prevention and Control, and we're housed within the Maryland Department of Health and Mental Hygiene. We're actually one of the centers within the Prevention and Health Promotion Administration, along with some other some other centers such as tobacco and also chronic disease.
And what is your mission? What is your mandate?
Our mission really is to reduce the burden of cancer in Maryland. And some of the ways that we're doing that is via funding cancer programs in the state. You know, we provide guidance, support, and also technical assistance to those programs. We foster collaboration among partners and different organizations and individuals in the state of Maryland. And we also do a lot of data analysis work to inform our programs and also activities to prevent cancer.
Very good. So you mentioned data analysis.
Mm-hmm.
What are the current data trends for cancer in Maryland?
So great question. So according to the American Cancer Society, in 2017, approximately 32,000 Maryland residents will be diagnosed with cancer. And sadly, 10,000 Maryland residents will lose their battle with cancer. So, you know, it's a big problem in the state of Maryland. So, you know, looking at the trends, you know, our role really is to figure out what we can do in terms of cancer prevention and control, and making sure that those programs and activities that we do are targeted towards meeting those goals.
How does the state of Maryland, with the programs that you offer, and the cancer trends that we'll be reviewing, how do we compare to other states in the country?
So we're actually doing fairly well. If we talk about trends over the years, between 2002 and 2012, we've seen a 13% decrease in the overall incidence rate of cancer in Maryland. So I think that's a great improvement. You know, I think credit goes to, you know, a lot of our cancer prevention, cancer screening efforts. Yeah, our overall cancer incidence rate mirrors that of the nation's rates. So we're almost similar. And we do a little better in terms of the cancer mortality rates. If we look at the trends, between 1989 and 1993, we were actually ranked third highest in the country for cancer mortality rates. So, you know, that wasn't something that, you know, that we were proud of. So the state had actually taken a lot of effort, put in a lot of effort into making sure that we improved on those numbers. And we did see some improvements. So in I believe it's 1996 to 2000, we actually improved to 11th place. And then between 2008 and 2012, we're now ranked 29th highest in the country in terms of overall cancer mortality rates. So great job, you know, just improving those rates.
Very good.
Yeah.
It's a very positive trend.
Absolutely.
Let's discuss then what are the trends in terms of specific cancers. What are the most common cancers in Maryland?
Sure. So for men, the most commonly diagnosed cancer would be prostate cancer, and that's followed by lung and colorectal cancer. And for women, it's breast cancer that's the most commonly diagnosed cancer, also followed by lung and colorectal cancer. Some of the other more common cancers you find in Maryland include non-Hodgkin's lymphoma, melanoma of the skin, cancer of the bladder, and cancer of the kidney and the renal pelvis.
Does that mix of cancers reflect the other states in the country, or are there geographic variations in terms of what's more common?
Pretty much so. I think, there might be slight variations within the different states, but I think for most parts, those are your typical cancers that you will find.
And are you finding within the state of Maryland the same mix in urban areas, such as Baltimore, versus rural areas, such as the Eastern Shore?
Right, so not so much in types of cancers, but we do see disparities among cancer incidence rates and also cancer mortality rates among racial lines, among sex, and also geographic lines. So you'll find the incidence of cancer in Baltimore City and the more rural areas in the state to be higher than other parts of the state. Over the past few years, we've seen a trend where among Black men and women, they do have higher cancer rates and also mortality rates compared to their white counterparts. And Black men overall have the highest cancer rates in the state. So those are definitely some of the disparities that we're seeing among the different populations in Maryland. And interestingly enough, we're starting to see some of those disparities with other population groups too, including your LGBT groups and also your immigrant population.
Now, the disparities, do you think it's reflecting genetics, lifestyle, or a lack of access to health care?
That's a great point, Dr. Dumont. I think it's a combination of all of them. So, I believe the genetics does play a part. But again, a lot of it has to do with access to healthcare, and also education, information. How much do people know about cancer screening services? Are they able to access those services and things like that? So I think they all kind of play a part.
So tell us what kind of programs are available through the center to educate the community about screening?
Sure. So we have a couple of programs in the center. So what we do is we do fund local jurisdictions to do cancer screening and also cancer education work. We also provide funding for cancer research programs. We do collect data, as I mentioned earlier, and analyze that data. And then we also have programs like the Maryland Comprehensive Cancer Program, which kind of integrates all our different stakeholders within the state of Maryland. But education specific, so what we do is we fund all 24 local jurisdictions in Maryland to provide cancer education services and outreach services to the state's residents.
And these are specific targeted screening programs, for example, for breast cancer or colon cancer, what have you?
Yep, that's correct. So within our center, what we have is the Maryland Breast and Cervical Cancer Program. We have the Maryland Colorectal Cancer Control Program. And we also have our Secret Restitution Fund Cancer Prevention, Education, Screening, and Treatment Program. So what we do is we provide grants to local health departments to provide no-cost breast, cervical, or colorectal cancer screening to low-income Marylanders who are program eligible. So there is some eligibility criteria that residents meet, and they can check with their local health departments to see if they meet those criteria. So some of the services that the local programs provide include being able to pay for cancer screening bills, scheduling appointments for the patients, helping them navigate through the system, making sure that they follow up with their providers, for any recalls, screenings, or things like that. And in the unfortunate event that, someone is diagnosed with cancer, be able to link them to treatment, if not pay for it. So those are some of the services that the programs provide at the local level.
So if a cancer is found, for example, a breast cancer, then there is a program available to deal with that contingency.
Correct. So the state actually has a program called the Maryland Breast and Cervical Cancer Diagnosis and Treatment Program. Again, it's targeted at low-income Marylanders who fit the eligibility criteria. And what this program does, it helps pay for breast or cervical cancer diagnosis and treatment bills. So if you are diagnosed with breast cancer and you can't afford your bills, if you meet the program's eligibility criteria, we can help pay for those bills.
Your funding is through the state of Maryland.
That's correct. We also receive some federal funding for our breast and cervical program and also our colorectal cancer control program.
Do you have concerns then, if there's federal funding, that if with the new Trump administration, that funding could be in some way compromised?
That's a great question. I think there's so much uncertainty in the air right now that it's pretty hard to tell, what's going to happen. We have been able to adapt to changes that have happened, in the past, with the passing of the Affordable Care Act, and also other changes in the political and health climate. So, whatever comes our way, we'll figure out a way to weather it.
Okay, very good. What is the Maryland Cancer Fund?
So it's actually a program that was created to help low-income Marylanders with treatment costs. So there's actually two components to the program. One is the cancer treatment grant, and the other one is the primary and secondary prevention grants. So for the cancer treatment grants, for low-income Marylanders who meet the program's criteria, they can apply for funding if they have either a cancer diagnosis or a finding that's suggestive of cancer. So they can apply via the local health departments for some funding to cover some of that those bills.
And what are the eligibility criteria?
So first of all, you have to be a Maryland resident, and then you also have to make at or less than 250% of the federal poverty level, and also have a diagnosis of cancer or a finding suspicious of cancer within 6 months of the application. So those are some of the things that you'll have to meet before we can process your application.
And then how does one go about applying?
So you can contact your local health department for more information. So if you live in Montgomery County, you would call the Montgomery County Department of Health and Human Services.
And I understand the general public can contribute to this fund?
Absolutely. So donations from the public is the sole source of funding for this program. So we really encourage members of the public to donate as much as they can to this worthy cause. There are two ways of donating. The easiest way would be a checkoff box in your Maryland state income tax form. So the tax season is coming up, so we do encourage everybody to go ahead and tick on that box. It's line 37, so don't forget that. The other way to donate is to send a check to the Comptroller of Maryland's office, and that can be done year-round. And we have that information on where you can send your check to and who you can write it out to on our website.
Why is it that there's no separate budget from the state for this fund?
That's an interesting question. I don't know if I have the answer for that. So.
All right, then we'll have to depend on the public largesse then.
Absolutely, that's right.
Well, thank you. We're going to pause briefly for a public service announcement. When we return, more with Dr. Lin Tai, and we'll be discussing cancer trends in the state of Maryland. We'll be right back.
A single ember from a wildfire can travel over a mile. You can't control where it will land, only what happens before it does. Visit fireadapted.org to learn how to protect your community from wildfires.
We're back. Our topic this evening is cancer trends in the state of Maryland, and my guest is Dr. Lin Tai. Dr. Lin, when we broke for the public service announcement, we were discussing different trends of cancer in the state. Let me ask you a question. What exactly is the Maryland Comprehensive Cancer Control Plan?
So it's a plan that serves as a guide and resource for all Marylanders who are interested in cancer prevention and control in the state. It provides us with goals, objectives, and also activities that we can do throughout the state over a set number of years. So we have targets that we intend to meet. We just updated the plan. It was just released last year. It covers the years 2016 to 2020. So it's a 5-year plan, and it was developed after input from various stakeholders, both in the private and also public arena. So everybody who's pretty much involved in cancer control in Maryland had a say on what we want to do in the next 5 years. So it's pretty much it provides us a comprehensive approach to meeting our targets.
And is this plan available for public review?
Absolutely. So there are two ways of obtaining the cancer plan. One is going to our website. We have a downloadable PDF that members of the public can look at and use if they choose to. And you can also give our center a call if you want us to mail in a copy.
And what would the phone numbers and the website be?
So the website will be phpa.dhmh.maryland.gov/cancer, or you can give our center a call at 410-767-5281.
Very good. Let's go on to discuss what an individual viewer can do to prevent colon cancer. So, for example, and some of this is gender-based.
Right.
So let's start out with a woman. What are some of the things you would recommend a woman viewer to be focusing on in terms of her health to prevent the variety of cancers we just discussed earlier?
So first thing is, get your screenings, get your regular screenings done as recommended. For instance, we have colorectal cancer screening, breast, and also cervical cancer screening. So I would recommend that women get those tests done regularly. The other thing you can do is, live a healthy lifestyle. Get to and stay at a healthy weight. So that involves, physical activity, regular physical activity, and also eating well, eating the right types of food, avoiding certain things like red meat and things like that. There are also other things that they could do, tobacco use. So tobacco accounts for almost a third of all cancer deaths in the U.S. So you would want to either, stop tobacco, and if you're not smoking, don't even think about it. But if you are a smoker, there are a lot of resources that Marylanders can have access to help them quit. The MD Quit line is a great resource. You can call 1-800-QUIT-NOW to get help with quitting smoking. They have professionals there who can help guide you throughout your journey. So we all know it's not easy to quit smoking, so it's always nice to have somebody to help out there. The other thing they can do is limit alcohol consumption. Right. So those are some of the things that are what people can do to lower their risk. Some of the other things, include trying to find out what your family history is. That's usually a risk factor for some of the cancers. So the more you can find out from family members, who've had cancer before, or risk factors, things like polyps and things like that, that will help inform your decision making with your physician on when to get started for screening and what kind of tests will be suitable for them.
I'm glad you mentioned for a woman including colon cancer screening, because there is, as you know, a misconception that colon cancer is only a male issue.
Absolutely, yeah. And a lot of people, when they talk about colorectal cancer, you think about an elderly gentleman getting that, but that's not the case. So women need to get their colorectal cancer screenings too.
Absolutely. And you touched upon an important topic, and that is obesity and cancer risk. Explain to our viewers what you are implying there. So, there are studies that show that people who are overweight or obese are at higher risk for certain cancers, for example, breast cancer and things like that. The exact mechanism, I think they're still trying to figure out what causes that specific link. But for what we can do is advise people to, as much as possible, try to maintain a healthy weight, because that not only helps you lower your risk for cancer, but for all other chronic diseases such as diabetes and heart disease. So that's something that we try and encourage a lot of people to do is to try and maintain or get to a healthy weight. Yeah. So let's shift gears then to a male viewer.
All right.
What kind of screening would you recommend for a male viewer to prevent the variety of cancers we've touched upon earlier?
Right, so colorectal cancer would be fairly important. We're also in the process of offering lung cancer screening within select jurisdictions in the state of Maryland. And as we spoke about, these are, cancers that are preventable, so what we want to do is encourage people to, especially if you're in that high-risk population where if you've smoked a certain number of years and you have certain risk factors, we'd like to get, these individuals in the lung cancer screening program. So lung cancer screening, colorectal cancer screening are some of the cancer screening tests that we would highly recommend for men who have those risk factors. Yeah.
I presume prostate too.
So it's really interesting. You know, I think recently the guidelines have come out and said, you know, we don't recommend prostate cancer screening for everybody. So it ought to be a decision that's made between the individual and also the physician after discussing, you know, the risk and benefits. Some men might benefit more from the screening. So it's important to have that conversation with the physician because, you know, the screening is associated with several risks. So we want to make sure that, you know, the individuals have all that information and be able to make an informed decision making. Yep.
Now, just to be clear, when you say screening, are you referring to a digital finger exam or the blood test?
This would be the blood test.
The blood test.
The prostate-specific antigen test.
Right.
The PSA test, right.
But I presume there's still a role for doing an annual finger exam to check the prostate.
So people still do the digital rectal exam.
Yes.
So, you know, in terms of, and I believe that's taken part as part of your annual examination.
Right.
Yep.
So there still is enthusiasm for that.
Still enthusiasm for that. That's right.
Yeah. Now, if our viewers are highly motivated and they want to help with the fight against cancer in the state, how can they participate?
So a good way of participating is by joining the Maryland Cancer Collaborative. So that's a collaborative that we administer within our center. And what its function is to bring together all the interested parties in the state to kind of sit together on the same table and figure out, you know, what can we work on together. So bringing together interested individuals, your hospitals, your public health professionals, your healthcare providers, you know, nonprofits, research groups, academia, pretty much everybody in the state that does something with cancer control, to sit down and say, hey, how can we work at, you know, coming out with solutions for the problems that we have. So you can join either as an individual member or you can participate as a representative of a group. Their membership forms are available on our website. So that's one of the ways you can participate. The other way is just spreading the word about cancer and cancer prevention. You know, talk to a family member, talk to a neighbor, a coworker, you know, and let them know, you know, these are the things that you can do to prevent cancer. You know, get your screenings done at the recommended time, you know, making sure you eat healthy and, you know, avoid tobacco and things like that. So everybody has a role to play.
Given the role clearly of a healthy diet,
right?
Does your center advocate any nutritional advice for the citizens?
So we don't have specific advice. What we do is we do try and follow or share recommendations from other organizations like the American Cancer Society or other nutrition groups. And so that's pretty much what we do. Yeah.
And are you offering any programs to assist with obesity?
Not at the moment, no. As part of our secondary prevention grant, as part of the Maryland Cancer Fund, we have funded certain counties to do healthy living activities via faith-based organizations. So those grants work on getting people to eat healthy, exercise, and pretty much, you know, empower them with the information that they need to lead a healthy life.
And then given the importance, as you said earlier, of smoking contributing to a significant subset of cancers,
right.
Does your center offer any smoking cessation programs? So
we don't offer smoking cessation programs, but one of our sister centers, the Center for Tobacco Prevention and Control, does fund local health departments to provide tobacco cessation. And they also run, like I said, the MD Quit Line. So that's also a great program that Marylanders can use. We have funded in the past some programs to do tobacco cessation work in specific environments, such as the hospital setting. If you were an inpatient and you were trying to quit smoking, you know, we provided some funding to help with cessation activities.
Now, some of our viewers may say, well, I switched from smoking cigarettes to e-cigarettes. What is the position of your center in terms of e-cigarettes and the risk of the variety of cancers we've touched upon.
Right. So there's still research ongoing on what the negative effects of e-cigarettes are compared to your traditional cigarettes. Our stance is mostly all cigarettes are bad, whether e-cigarettes or traditional cigarettes, because there's, we still don't have a clear picture of what the negative effects are. We're taking the precautionary approach and saying that, we don't think, if you don't know what's going on or what negative effects it can bring you, let's just not start. Some people are using that as a cessation tool to, we don't think, and I think research has shown that it's not what it promises to be in terms of, being an effective cessation tool. You're just merely moving from traditional cigarettes to e-cigarettes. So, some of the effects are still there.
Well, I certainly concur. Dr. Lin Tai, thank you so much for joining us on Housecall. If our viewers have any questions or want more information, how can they reach you?
Sure. They can reach us at our website. So it's phpa.dhmh.maryland.gov/cancer. And you can also give us our call at 410-767-5281. And we'll be more than happy to answer any questions that anybody has.
Thank you for joining us on Housecall.
Well, thank you for having me.
My thanks to Dr. Lin Tai for joining us on Housecall. My thanks to my terrific team here at the station. And most important, thanks to you, the viewer, for making Housecall the success it has become. We're now broadcast prime time, 5 nights every week. Let us know how we're doing. We're open to suggestions for future program topics. You can reach me at montgomerygastro.com. As for our next show, it's going to be an important topic, colon cancer screening. What can you do to prevent cancer for you and your loved ones? Find out next time when my guest is Dr. Sindhu Stephen, a noted gastroenterologist here in Montgomery County. It's going to be a terrific show. See you then next time for another edition of Housecall. Good evening.